much for tuning in to KBTV. I'm Dr. Karlisha Booze. For this week's Wellness Wednesday, we're raising awareness of breast cancer. The month of October is Breast Cancer Awareness Month, and this morning I'm joined by Dr. Ashley Ray with Piedmont Macon. Good morning, Ashley, and thank you so much for tuning in and talking with us about the awareness of breast cancer.
Good morning. Thank y'all for having me.
Absolutely. So, Ashley, why is it so important that we spread awareness of breast cancer?
So I guess the most staggering statistic that everybody knows or hears is 1 in 8 women actually will develop breast cancer over the course of their lifetime. So that means that every single one of us in some way is going to be affected by breast cancer, whether it's personally, our friend, our mom, sister, aunt, grandmother, somebody's in our lives is going to be affected by this disease. So we need to be aware of it and know how to detect it and treat it.
Okay, speaking of detection, Dr. Ray, what are some symptoms or some things that women may experience and want to go ahead and go see a doctor for early detection before it gets too late?
Yes, ma'am. So I think that we are the most aware of our bodies compared to anyone, right? We know when something's different, we know when something changes. So, for example, pain normally is not a symptom of breast cancer. I know it causes us some alarm, but that's normally not a symptom of early breast cancer. But if you're having pain, you should go to the doctor and have it seen about. If you feel a new lump, definitely go get that seen about. Any changes in the skin, a lot of times that could be infection, especially if we're nursing, but sometimes it's not. Sometimes that's how breast cancer can actually present. Nipple changes or nipple discharge when we're not lactating as well. So any kind of change, definitely go see your physician and we can figure out what's going on.
Okay. Now, studies have shown about 60% drop in mammograms due to patients' fear of COVID. Why does that alarm you?
So as a breast surgeon, that's really scary to me because the best way for us to be able to treat you and fight this illness together is to catch it early. So mammography is the best tool we have for early detection. It can detect things while stage 0. And if we have something that's only a year old to compare, even something that's really subtle and new, we can work up from there. If we don't screen, then by the time we do catch the disease process, then we're probably farther along in this disease process. It's more difficult to treat, and we may not have as good of a result or outcome.
Okay. So, what can you tell us about the latest screening and treatment options that are available?
Okay. So, mammography is the gold standard. We've been doing that since the 80s. Any woman over the age of 40 or 40 and up, we definitely recommend going to start your screening mammography. We actually offer 3D mammograms now, and most places are doing those. The difference is old school mammograms were an x-ray that was only 2 pictures in 2 different directions, and then we're looking at a 3D object because our breast obviously is a 3D thing. Tomosynthesis or 3D mammograms now gives us 50 to 100 pictures of each breast, so we're actually much more likely to catch something going on with this imaging modality, even though we're only doing the camera in 2 directions like the old school mammograms. We also have other adjunct studies for women that may be higher risk, adding MRI for those women. There's some newer imaging modality called molecular breast imaging. We don't typically recommend that as a screening alone. We need mammography and MRI, but if someone were to have dense breasts, for example, that's an adjunct that we could add in our screening repertoire. But yes, and then from a screening standpoint, for those of us with family history, we actually do have specific guidelines based on individuals' family history to start screening earlier or more aggressive screening. So if you do have a family history, that's another reason to come in and see your PCP, your OB, or even your breast specialist in the area, because we can actually swing it so insurance will cover you to get extra screening.
Perfect. Perfect. Well, thank you so much, Dr. Ray, for this helpful information. And for our viewers, the month of October, Piedmont Macon and Piedmont Macon North are both offering $59 specials for mammograms. You can set an appointment on a weekend for those of you who work during the week, and those are good for the month of October. And thank you so much, Dr. Ray, for coming on. And I hope this information helped most women out there who are dealing with this.
Hey, are you experiencing algae, mold, dirt, or pollen around the foundation of your home and your driveway? If so, call Reed's when you're in need. Reed's Power Washing Service has next day service available. Select service less than 2 hours. You're thinking, Reed's Power Washing Service is homes, that's all we do. Nah, we do it all. Driveways, fences, porches, and we clean your rides. So call that number on your screen today and get you a free quote.